Which countries are reporting surge in COVID-19 cases? Should you travel to these countries 5 years after a deadly pandemic swept the world? COVID-19 cases are rising across the world, especially in Hong Kong and Singapore. The number of cases rose by 28 in Singapore, while Hong Kong logged 31 severe cases in just a week. Singapore is on high alert as the estimated number of COVID-19 cases in the week ending on May 3 went up to 14,200 from 11,100 a week before. Daily hospitalizations also saw a roughly 30 increase. On the other hand, the virus has surged to a quite high level in Hong Kong, according to experts. In the week ending May 3, 31 deaths were reported, marking a one-year high. This sudden rise in COVID-19 cases has sparked fears of a new variant. In Singapore, COVID-19 cases in the country saw a drastic increase. Singapore's Ministry of Health said that LF.7 and NB.1.8, both descendants of JN.1 variant that is used in new COVID-19 vaccines, were circulating in the country. The daily hospitalizations increased from 102 to 133, but daily ICU admissions declined slightly from 3 to 2. Hong Kong, there has been a spike in COVID-19 cases in Hong Kong, from 6.21 of samples testing positive 4 weeks ago to 13.66 in the week leading to May 10. Hong Kong has recorded 81 severe cases, with 30 deaths, almost all elderly people with underlying health conditions. China, COVID-19 cases are rising in China once again, nearing the peak levels seen during the viral wave last year. The Chinese Center for Disease Control and Prevention reports that testing positivity rates have more than doubled in recent weeks. Thailand, the Department of Disease Control in Thailand has reported 2 cluster outbreaks this year, and health authorities are closely monitoring the situation. The surge in cases came after the Songkran festival in April. Also read COVID-19 surge in Asia, how dangerous is JN.1 variant and are existing vaccines effective? As per the Ministry of Health's COVID-19 bulletin, there are 93 active cases in India, but there have been no reports of a resurgent coronavirus wave. Health experts have advised people not to panic and follow basic precautions, such as wearing masks in crowded places. While the likelihood of a severe wave in India is minimal, staying alert remains a wise precaution, virologists and health experts told NEWS 18. However, mild infections can still occur, often resembling common cold or flu symptoms. And if you are traveling to these countries, it is important to consider several things before you plan your trip, i.e., the severity of the COVID wave, your health status and local restrictions. If your trip is non-essential, it is best that you avoid traveling to countries where COVID cases are rising and look for alternatives. In case of essential travel, you should follow precautionary measures like wearing a mask, avoiding crowded areas, regularly washing hands and taking booster shots before getting on the plane. It is also advised to monitor your health and carry hand sanitizers. And swipe left for next video. Health authorities have cited waning immunity to COVID-19 cases as a reason behind the resurgent cases seen in several countries, along with fewer elderly people getting their booster shots. As long as you are healthy, vaccinated and not in a high-risk group, there is no reason to be worried. Since COVID-19 is now endemic, new waves appear from time to time. These waves are being treated as common flu outbreaks. However, people in older age groups and those with underlying health conditions should consider getting a booster shot and follow basic precautionary measures like wearing masks and avoiding travel while sick. Latest blogs.